Ms. Robbins.
Hello, Doctor.
Hi, I'm Dr. Muglia. I'm one of the psychiatrists on the ward, and I understand your daughter Millie has been admitted to our ward.
Yes, that's right.
I wanted to come and talk to you more about her condition and answer any questions you might have.
Okay.
What would you like me to call you?
Oh, Kathy is fine.
Okay. Kathy, what is your understanding of what's been going on with Millie?
Well, she collapsed in the street. She'd been home, having left university, and had been very upset. She's split up with her boyfriend and wasn't feeling too bright, but then a week ago collapsed in the street, was brought into hospital and doesn't seem to be able to move, eat, drink, speak. She's just not at all functioning.
Okay, so it sounds like it's quite a difficult time and you must be really worried about her.
Yes.
Okay, so I understand that, so what you're telling me is that Millie has been going through some psychological stresses, so it seems like there's been some concerns with her relationship.
Yes, she split up from her boyfriend. She was very upset, and I mean she came home from university early before the Easter holidays began, so...
Has she been doing exams or anything?
No, but I think there was work piling up for a dissertation, so she'd been under quite a bit of pressure.
Okay, and from the information I've been given is that we've done all the investigations with Millie, so we've done scans, bloods, and they've ruled all physical causes to identify why Millie's not eating, why she's not drinking, why she's not communicating. Right. However, all of them have come out normal, so we've not found any physical cause for presentation.
Which is good, I suppose.
It is. Yeah. It is reassuring because what the possible diagnosis is that it possibly called something which we call dissociative stupor. I'm not sure if you've heard of that.
No, I've never heard of that.
Okay, so stupor, as that term, it means when someone doesn't move, there's no movement, and doesn't talk, and they don't eat as well.
Right.
Yeah. And sometimes it's combined with dissociative stupor. That's another term, which means that a person has coped by dissociating. So what it means is that she's undergone severe psychological stresses, which has caused her to present in a physical way.
Okay.
Do you know how our mind and body is linked?
Not really, no.
Okay. So for example, if we've had a stressful day, we might present with a headache.
Okay.
Yeah. So it's similar in Millie's case.
Right.
So she's undergone severe psychological stresses with relationships and university, and as a result, she's now presenting with a physical symptom.
I see. Okay.
Does that make sense?
That does. Yeah, I can understand that.
Yeah. Well, obviously the main cause is a psychological stressor, but we will still continue to do investigations to ensure we're not forgetting that there could be something physically, wrong with her.
Right.
But at the moment, it's looking most likely that it is a dissociative stupor.
Okay.
Yeah.
Can she get better from that?
Yes, the reassuring thing is, Ms. Robbins, is that dissociative stupor is treatable.
Okay.
So I'll discuss the range of options that we have of treatment in terms of medication, psychological therapies and social interventions. But it's also something that there's a good recovery rate, so at least 6 to 7 out of 10 people do recover from this.
Okay. That's good.
Yes. So, our main way in which we want to manage Millie is that we want to keep her in hospital.
Okay.
Yeah.
How long for?
Well, it's difficult to say for how long. It depends on how she responds to the treatment that we are giving her and how soon she starts to talk and to eat. I understand she has made some movements recently.
Just a little. Not certainly not normal, but a little bit.
Yes, but that's a good sign.
Okay.
So what we'd like to do is keep her in hospital, just monitor her by checking her vitals, like her blood pressure, pulse and temperature, and we do regular bloods. And because she's not eating and drinking, I know that's a concern, what we will do is ensure that she's got on a drip, and that she gets any other parenteral nutrition. So she can be nutrition that we can give her, like a nutritional supplement.
Oh, I see. Okay. Yeah.
Like 40 sips or any other drinks initially. And we'll continue to monitor her intake and her output as well.
Right. Okay.
Yeah. In terms of medication, well, obviously there are some medications we can use, but we only use it as a last resort.
Okay.
The guidelines we follow, there are some medications like benzodiazepine. I don't know if you know that group of medication, like lorazepam.
No.
Okay, so that is used as well as a treatment for dissociative stupor. So we can use that, and if we find that it could be that Millie has a comorbid condition like depression, we can use antidepressant medication as well.
Okay.
Are you following me so far?
Yeah.
The other form of treatment I'm just going to mention, but not to alarm you, is something which we call ECT, but that's used in severe cases when someone doesn't respond to the treatment that we are giving.
Right.
Okay.
What is ECT?
So ECT is where electric current is passed, and it produces a fit, which can cause a person to improve if they've got depression. But that's something I can discuss with you at some other point. I don't think it's going to come to that.
Okay.
But it's just to mention, I know that can be quite alarming.
Yeah.
The main treatment option, which I should have told you more about, is actually the psychological or the talking therapy, which is essential.
Right.
And that's because Millie has gone through a difficult time and she needs some form of counselling or talking therapy.
I see. And that alone might be enough to get her better?
Yes.
Okay.
So I know I've discussed a lot with you, Ms. Robbins, but what I've told you is that Millie's got dissociative stupor, and we're going to treat her by keeping her in hospital and making sure that she's getting enough fluids and food. And we're going to look at medication and psychological therapies.
Okay.
I'll give you a leaflet that you can read as well.
Okay.
Thank you.
Thank you very much, thanks.